and it is one of my last occasions to be here with you. So I would like to thank you very much for your presence here. And I would like to forward boxes with chocolates. It is my nice task to all our speakers. And may I invite our last speaker, Tilly Metz, member of European Parliament, to close our meeting. It's my honor to meet you, and thank you very much.
So I start already doing the chocolate distribution to come with my conclusions. First of all, I would like to thank all the speakers for their very, very interesting presentation. And I must say, it's not easy to speak after such high level and very interesting presentations. But thank you also for the personal testimonies that you made at the end. I found that always very touching, but also it is very motivating, the words that you were formulating, all of you, and to give us also a lot of energy for our work in the European Parliament. The presentation also showed not only the complexity of the issue related to big data and artificial intelligence, but also the exciting possibilities for improving the lives of people living with dementia. And by the way, also showing possibilities, as Sirpa and I were saying, of phasing out animal testing with much more efficient methods that we have been presented here. So challenges in terms both of infrastructure, regulation and legislation have been identified during these presentations. These cannot be overcome really by a single entity, project or action, but it really requires a substantial and coordinated effort between policymakers, between the industry, research partners, healthcare systems, civil society to make it happen. Because we also heard, speaking about civil society, how important it is that we have a change of mentality regarding especially patients with Alzheimer. At the EU level, a key opportunity for progress lies with the forthcoming, and we heard a very interesting presentation of the European Health Data Space, which should both improve the experience of citizens, but also really open doors for improving the use of data to boost research across Europe. This latter point will be key for the ENVI committee to explore. It is not only important to focus on what these developments mean for research itself, but also for clinical practice and delivery of services. The findings from research projects, where the focus on understanding how, like we saw it, the condition, helping also the identification and diagnosis of dementia, or, and this is really also very important, new ways of providing care and support must translate into changing the way in which we work. As shadow rapporteur for the European Greens on the EHDS, I was very interested in hearing your perspective on this. I'm indeed deeply committed in making the European Health Data Space platform work for patients and avoid the creation of a platform that would not put patients' needs at its core. I believe the EHDS has a lot of potential to be a game changer, but that was really underlined today. But a few challenges lie ahead. First of all, the potential of the EHDS will only be realized, let's be honest, if investment is made into health and social care system, to modernize them, to enable them to make use of data generated by healthcare systems. For instance, in planning and delivery of services, and for clinicians embedding the use of the latest technology into their practice. And as we heard it, we need also clinical validation of these new methods. This also means that training is a key component for the success of the EHDS. I will add that creating a fair system will be central, ensuring that the data shared by patients and the efforts by the healthcare practitioners to update their files will in the end beneficiate to the patients. What I mean is there is a risk that some companies will use the data shared to develop new beneficial drugs, but at prices hindering access to it for the most of the patients in the EU. We need to think ahead and find solutions that will boost, on one hand, innovation, but also make sure that they have then access to it, as they made already a contribution, and that this contribution with sharing their data is also recognized. Finally, I would like to say that the EU for Health program, unprecedented level of funding, not to mention the creation also of the Health and Digital Executive Agency, which is working since April 2021. This represents greatest opportunities in recent years to use big data and technology to radically reshape and improve the health of our citizens. However, it also requires member states to show the same commitment and drive as we do today. We must all ensure this message is heard in our respective countries and urge our government to take advantage of this opportunity. Thank you very much. Thank you.